and you have joined Ask a Care Navigator, Mondays with Maureen. Hello, everyone. My name is Maureen Williams, and I'm the Director of Care Navigation here at Four Seasons, the care you trust. This is my special colleague, but wait, she's worth waiting for. If you have any questions or comments, please drop them into the comments box either now live or later, or you can call us at 866 466 9734, or please go to our website. We have so many wonderful resources there. Forseasonscare.org. Spell out the number four, FOURSEASONSCARE.org. And you can send inquiries and comments and questions there. We try to create this space on most Mondays to talk about issues associated with living well and aging well. And I have been shamelessly promoting Four Seasons services for the last 5 or 6 weeks. And today I'm joined by my special friend and colleague, Krista Blanton.
Hi, everybody.
Tell us what you do here at Four Seasons.
Yes, thank you for having me. My name is Krista. Just to reiterate, I've been here since March of 2021.
Wow, you came in the pandemic.
Yes, yeah, that was a wild ride. So I was a new nurse practitioner here with Four Seasons in Palliative Care. I had done like a 3-month little stay in internal medicine office and decided something different was for me. I am a palliative care nurse practitioner,
Yes.
and I see patients in hospital settings, assisted living, skilled nursing homes, clinic.
In fact, we're sitting in the
We're
clinic right
in
here.
the clinic
Here, we'll
space
show.
that-
See, we have clinic space.
We're in the clinic space where I see
In the corner.
patients once a month. We're going to have to expand that to a day and a half a month because we are getting so many patients who are eligible to see us in clinic. And we can dive into that a little
Sure.
bit later. But we focus on symptom management and goals of care, and
Well, we're
we
going
can
to
get
talk
all
about
into
that
it.
because many people have no idea what palliative care is. Some have interesting ideas about what it is.
Yeah.
Tell us what palliative care or palliative medicine is. Just share with our audience.
Palliative care is a subspecialty of medicine. So just like any of the ologists, right? Like cardiology, nephrology,
Dermatology.
any of the ologists, we're also a subspecialty of medicine. And we focus on patients' comfort and quality of life in life-limiting illnesses or serious disease, and specifically within that time frame of like 2 years or less of a prognosis. So broader than a hospice prognosis, and we focus on goals of care, complex medical decision making. So in that, we're down to a few years of life left. What is it? Treatment options that are being offered. What are the pros and cons of doing more diagnostic tests, potentially finding yourself in and out of the hospital more frequently, and like how does that match up with your values-based goals and like what you really want, to kind of help formulate a better medical plan of care.
So as a medical subspecialty, you're able to take all those pieces and put them together for the patient family.
Exactly.
Okay.
Sometimes I break it down and just say we're kind of like the cog in the wheel. So you may find yourself surrounded by
all the ologists,
the primary care, the ologist, everybody else, and we kind of are a medical interpreter for making sense of what's being said around you.
I love that, a medical interpreter.
Yeah.
See, when I tell people what palliative care is, I talk about that goals of care. I'm just gonna hijack that medical interpreter.
Interpreter to like kind of make sense of what everyone's saying around you. We can give more time and space for that conversation to happen than your 15-minute, rushed appointments where you may have a lot of burden and questions on your mind that aren't able to get out in the open. And so we just kind of break all of that down and help make those complex decisions like, will I or won't I pursue dialysis, or will I or won't I pursue chemotherapy or radiation?
And what happens if you don't, and what happens if you do?
Yeah.
Okay. And it literally, I like to say, forgive me, Krista.
Yeah.
It's could be a kitchen table conversation.
Oh, yeah, absolutely.
Living room conversation.
Wherever you're comfortable.
For a long period of time.
Yeah. So our initial visits, we really spend as much time as we need to with the person. But we're allotted about an hour and a half for those new patients.
Wow.
So it's quite a big difference. And we're not focused on the physical assessment piece or like adding a bunch of these things in. It's really focused on what's important to you.
Lots of listening.
Lots of listening.
So we've talked
Yeah.
about to my audience here those complex medical decisions. So I hope you're seeing a sense of what palliative care can help guide you through. They're not making the decisions, are you?
No,
No.
not at all. Yeah, you're
Mhm,
still the driver of this
mhm,
ship. We'll kind of we try to pick up on things that are said that give us a clue into like what quality of life means to the person,
yeah,
because that's different for everybody. Some patients
right.
say I want to see every single day that I can, regardless of the burden it may have on myself or my family or where I experience that.
Which is fine.
Great. Yeah, we can at least make that hopefully more comfortable.
Mhm.
And some patients say there's a limit to what I'm willing to put
Mm,
myself through. And everyone has their own threshold, their own line in the sand that they're not willing to cross,
yeah.
that makes life less fun.
Wow.
And then we try to create a plan around that.
So it's the
Yeah.
plan that's special, the
Yeah.
really special. So you talk about the two pieces of in that plan. Tell
Yeah.
us about
So
that.
I usually tell people palliative care has two different pathways. One is that goals of care relationship. You may start out on one trajectory and then find yourself with more symptom burden or in and out of the hospital more than you'd like to, and we have to kind of shift course. And the other piece of that is symptom management. So
Mhm.
at home or wherever you call home, symptom management for things like pain as it relates to that serious illness,
Mhm.
which is a little different than just chronic pain management. And
This is not chronic
this
pain
is not
management.
chronic
Not.
pain
Mhm.
management. Not, I shouldn't say just, because chronic pain is real and it's
Mhm.
debilitating, but there are specialists out there for that.
Mhm.
Palliative care focuses on the pain and discomfort of the illness that we're seeing the person for. So, like
Like
that
heart failure. We both
heart
went the
failure,
same
yeah, heart
place.
failure, difficulty breathing, like those are the
Mhm.
most distressing symptoms that a lot of people face, or cancer related pain.
Yes. Yes.
Um,
And chemotherapy related discomfort from the
Correct.
treatment.
Yeah.
Gotcha.
Yeah. So things like that, psychological distress, and we that may not mean that we're always prescribing a pill, but we're pulling in people like our social workers, and sometimes calling on our chaplain
Right.
group or music therapy group to kind of help paint a bigger picture and
Right.
provide care.
Right. So pain and shortness of breath are common symptoms you treat,
Oh yes, yeah.
and there's is there another one like what's the top three or four?
I would say probably shortness of breath,
Mhm.
cancer related pain. We live in an area with aging adults, so dementia related, you know, uh, symptoms that,
Anxiety, agitation.
yes,
Okay.
especially those I'd say are more reported by the caregivers, right?
Right.
So if you have
Right.
an aging patient at home, and you're seeing a lot of insomnia or delirium, agitation, anxiety, that's very hard and difficult to manage within like a nuclear family.
Right.
And so we're getting reached out a lot by those patients, caregivers, to discuss
Right.
what do I do now.
Right.
Those would probably be the top three.
I think what's something Krista just said, y'all. What do I do now? If any of you are facing that and asking that question now,
Mm-hmm.
that might be a good clue. It's time for
Yes,
palliative care.
absolutely. Yeah. And to talk with your specialist and your primary care provider and say, is there a lot more that I can hope for, that we could do to
Mm,
change this trajectory? And if not, these are the burdens, the symptoms I'm having, and would palliative care be appropriate to have in my
yeah.
home, again, wherever that is considered
Well, you
home?
just said talk with your specialist or primary. How do people access palliative care?
Yeah.
There's some tricks out there.
Yeah, yeah. So you can always visit our website, and we'll always take a self referral. We'll just have the people in our back end reach out to whoever is kind of managing that disease process you have, ask for records and things like that.
Mhm.
It's always probably easier and smoother to get started faster if you would have your primary care or specialist right in order, giving some indication of why palliative care, why now.
Right.
Yeah.
Suppose my loved one lives in a nursing community or an assisted living
Mm-hmm.
community. How do we do it there?
Yeah, kind of the same way. I would speak with whoever that key person is in the facility, the one that really always seems to be able to move needles
Yeah.
forward. That's different in every facility.
Mhm.
Sometimes it's the primary care group, sometimes it's the MDS coordinator, sometimes it's the social worker. Whoever your
Yeah.
point person
Yeah.
is, go to that person and say, "Hey, I see we're really struggling with whatever symptom, or what to
Mhm.
do next, or what our next like goal is, trajectory is. I'd really like to have palliative care as a second pair of eyes.
That's a perfect one.
Yeah.
And Krista, in our audience too, Four Seasons is blessed to have palliative care teams embedded in various
Mhm.
hospitals around here.
Mhm.
So
Yep.
if you're asking what next, and your loved one's in the hospital, that
Absolutely.
ask for a palliative
Ask for
care
a palliative
referral.
care consult. Yes. And any of the hospitalists can put that order in, and we come by and see where the patient's at. Again, medical interpreter. We read through notes and
Oh
notes and
yes,
notes of what's going on this hospital that's different from previous
right.
hospitalizations, and what to expect when you get discharged, and how to best support you, just based on what your goals are.
That's it, because your goals may have changed.
Your goals may have changed. Yeah.
Wow.
Yeah.
Wow.
So, I mean, if you're, fifth hospitalization with a COPD flare, and, 1 through 4, you really wanted the steroids and the antibiotics and maybe some advanced respiratory support. And now it's looking like this is becoming more your normal. And that's not where you want to spend most of your time. If it doesn't get better, then we can work out a plan for that.
I love it.
Yeah.
It's kind of an aggressive treatment plan for comfort.
Exactly. Yeah,
Yeah.
we say we kind of shift our focus from aggressively treating the disease itself, because all of these, conditions have some sort of limit to them, where the things that used to work for us to keep us at home stop working as well. And so we shift our focus from aggressively treating the illness to aggressively focusing on your comfort and quality of life.
This works. This works.
Yeah.
Well, now people will ask, what does this cost? How is it covered?
Yeah,
Is
good
insurance
question.
covered? Yeah, this is a big question.
Yes, so your insurance will cover palliative care, most of them. Sometimes in the facility, we got to ask, what kind of Medicare plans.
Yeah.
I know you talk extensively about those on your
Yeah.
other meetings like this. And so some of them don't cover palliative care, but most insurance companies will.
Yes.
And so we usually say whatever your copay is for your primary care or other specialists, you could expect to pay for us. Most of the time it's $0 to a few dollars.
Yeah.
We never really know until we send in that first visit bill, but most of the time you can kind of anticipate what you spend on your other healthcare needs.
So it's Medicare Part B is where you all bill. And I want to give a plug for Four Seasons Foundation, because Krista and I and all of our services, if you're eligible for our services or desire services like what I do, but if you're eligible for palliative and you don't have insurance or don't have complete coverage, we provide care regardless of ability to pay. That's thanks to our Four Seasons Foundation. So don't let that hinder you. If you think someone like Krista would help you in your life and your family's life, call us. Just call us.
Absolutely, yeah.
We'll work it out with you. We really will.
For sure.
Have I not been nosy enough to ask you something?
I'm trying to think of what we talked about. No, I would say, if there's tons of topics we've talked about, we could break out into more in-depth conversation about how to fill out advanced directives, or, you have a loved one who you've been named, guardian of or in charge of, is that legally formal? Is it not? All kinds of things. So anything like that you're just questioning and wondering about, that's what we're here for.
That's what we're here for. Krista, I didn't mention this to you, but frequently on this, some of the things that I do, I talk about the most form. And the most form is the medical orders for scope of treatment. And many times people say, how do I get one? Well, you talk to your physician, but this is a key tool that palliative care works with too. So if you find yourself with a loved one in serious illness, this is going to be part of your conversation, isn't it?
For sure. Yeah, we can help with the most form, with the code status discussions, probably more at length. Again, your primary care can have these discussions as well. Sometimes it's done in the context of that Medicare wellness visit.
Yeah.
But sometimes all of the questions aren't answered, or you don't feel like you have time to really explore what each of those sections means, or, how the decisions should be shaped in the context of the disease that you have.
Yeah.
So while someone may do fine with full scope of treatment for a long amount of time, someone else may not. And so just exploring and unpacking some of those questions around each section is what we specialize in.
I love this. Having those complex conversations.
Yeah.
Now, another thing too, and this is important because people ask me, well, what happens as my loved one progresses? I have such confidence in my palliative care colleagues when you have to have that difficult conversation about it's time for hospice.
Yeah, and just kind of normalizing it, right? I always tell people up front, sometimes we hear those stories about, well, I'm hesitant to put mom on hospice or dad on hospice or brother or sister because so and so had it and they passed within, a few days, and I just don't want them to be gone that soon.
Mhm.
My work method is, if that happens to one of my patients, I maybe wasn't as aware of some of
Mm.
those early red flags to get them on service as soon as eligible.
Right.
And so, again, that's different for everyone. Some people don't want that service until the last days or week
Yeah.
of life. But it serves people the best and the
Mm.
most if we can get them on service with hospice long before the last days to
Yeah.
weeks of life. Then you don't really get to experience the full scope of what support is available, especially
Yeah.
if you're trying to do this from home.
Oh, it's so hard.
Yeah.
I've found that people that have worked with palliative care, that families worry about, how do I talk to mom or dad about hospice? Well,
Mm-hmm.
they're experts at the conversations and the goals of care.
Yes, for sure.
And how many times have we been surprised that mom or dad have been thinking hospice all
Oh,
along?
yeah. Thank you.
Yeah.
They say thank you for talking about this with
Finally.
me. Yeah.
So seriously, these physicians, nurse practitioners, physicians assistants, social workers, nurses in the palliative care program, this is their expertise.
Mm-hmm.
This is their ology.
Yeah, exactly.
This is what they do, and they help families
Yeah, I guess
and patients.
the last piece that I'd like to, one thing that came to mind is I want to tell people what our team is made out of.
Yes.
Who's on a palliative
Yes.
care team and what do they provide? 'Cause
Yes.
it's a little different from hospice.
Yes.
So you would have a nurse practitioner, a PA, or an MD come out to wherever home is, usually about every 4 to 6 weeks. Sometimes that's longer if your loved one's on a really long, dementia comes to mind because sometimes that can be a really long
journey.
where we have, peaks and then we plateau and then we have decline and then we plateau.
Yeah.
And so it can be longer than that. We don't have to be in the home every 4 weeks. Or it can be much shorter than that, like every 2 weeks if we're making close medication adjustments and things. We do have a nurse on our team who does more phone triage support. She calls all of the home new referrals and does a nursing assessment to make sure that palliative care is something that would benefit the person, explain services, all the good things. They're fantastic. We do have a social worker available on each region. So we have a north, a south, and a west region for palliative care, and each one has a social worker to help with resource, navigation and things. And then we work within this beautiful big organization where we can also pull from people like Maureen and other social workers and music therapy and chaplaincy and all these other things as needed.
I like to say we have the bench strength of 4 seasons.
Yeah.
It's a blessing.
Absolutely, for sure.
I am so glad you came to join us, and I hope all of our audience has a little bit better inkling of what palliative care is. Oh, there's so much more.
Yeah, so much more. Well, I'm sure we'll talk again about some of these nitty-gritty
Absolutely.
things.
And I want to do a show and tell. This is our palliative care brochure. If you want to get it virtually, go to our website, fourseasonscare.org, and click on resources. And there's a whole virtual brochure rack. And this is one of them to tell you all about palliative care. I mean, it really expands out. There's a lot of information in here. It keeps going. It's a four-fer.
Yeah.
But we cover palliative care is provided in all of 14 counties that we serve. And so go online for more information about it. You can call us 866-466-9734 to ask about palliative care. So many people will be happy to answer your questions.
Absolutely.
If you want to get a hold of Krista and me, that's the same way to reach us. Or you can go to our website, fourseasonscare.org. Or you can drop comments in from whatever platform you're viewing, YouTube or Facebook. We'll be glad to respond. So thank you for joining me.
Thanks for having me.
My wonderful colleague here. And please, hey, join me next Monday. It's going to be the 25th of August. My colleague Paige Wheeler will join us, and she's the executive director of our foundation that permits Krista and I and all of us here at Four Seasons to provide care regardless of ability to pay. So that's one of our services that I want to feature. So thank you all very much. Thanks again.
Yeah, thanks, Maureen.
You're welcome.
Bye, everybody.
Bye. Let's see if I can do this right.